So again, it comes down to brain, body tissue connection. But there's a lot going on there with your lungs. So you got muscles. So you got the diaphragm, which is connected to this big, huge nerve called the vagus nerve. That if it's relaxed, if it's clear, if that vagus nerve is sending down signals, it actually turns on what's called the parasympathetic nervous system. That allows for relaxing. A lot of times with asthma it comes up, there's this anxiety or there's stress or exercise, which is stress, right? That's where this asthma comes in. A lot of the times then there's that constriction. People don't realize this. There's muscles in your arteries. Yeah, there's muscles in your arteries. And so that comes from this constriction of those arteries. There's that decrease of oxygen being able to get to the blood flow. Well, guess what? That parasympathetic nervous system relaxes those, allows them to open up correctly. And so there's that clean exchange of oxygen into the blood and stuff like that. And there isn't this constriction of the muscles in the rib. There isn't this constriction of the muscle in the diaphragm when that signal is able to go through cleanly. And that's the same with things like anxiety attacks or panic attacks. There's this ability that something's being tightened, and that's the sympathetic nervous system running rampant. It's allowed to do that when the parasympathetic nervous system is being cut off. That's all controlled by this big nerve called the vagus nerve that travels from the top neck bone region, the brainstem, and it travels all the way down into the gut region and communicates with all of those tissues and cells in there to do the relaxing. And so if that's cut off, well, you got a lot of things. What else can that contribute to? Well, let's talk about digestion. That's the vagus nerve again. There's digestion issues there. You want to talk about heart palpitations. Again, could be vagus nerve. And that connects all the way down to the top of the kidneys. So we have a lot of connections in there that could be being disrupted. I'm not saying that's the only issue, but it's a good possibility for one major issue that's causing these tissues to go awry or act in spastic motions, because the sympathetic system is allowed to run rampant when the parasympathetic system is being cut off.